Welcome back. Well, today is World Kidney Day. It's a global campaign aimed at raising awareness of the importance of our kidneys. It hopes to reduce the frequency and impact of kidney disease and its associated health problems. Now, in case you didn't know, kidney disease also affects children. Well, the Nelson Mandela Children's Hospital has one of the biggest dialysis units in the country. Joining us is the hospital's nephrologist, Dr. Tholang Khumalo. Doc, good morning. Good morning. And thanks for your time this morning. And yes, I suppose it is very strange to actually think of children having major kidney problems that they would require such treatment. Give us some idea of what are some of the cases involving children that you deal with.
Good morning, Rebecca. The cases that we see actually range in size. We're seeing kids from the newborn stages, and we actually see kids up to about 14 years. Usually the younger kids present with birth defects, so any kind of blockage along the urinary system. And then the older kids that we're seeing are more the nephrotic syndrome, which is when your kidney's not able to hold any protein, so you pass protein in your urine.
So what are the common causes of such conditions in children? Is it genetic? Because I know you have families where there are kidney issues, and yes, you stand a chance later. Would it be complications with the pregnancy? What are the causes?
So there are multiple causes, and some of them are actually multifactorial. So you find it's more than one cause leading to the disease. In some cases, like with the congenital defects, usually sometimes it's just there might be like an infection or some sort of interruption at some point during the pregnancy. Some of them are genetic. Like you said, there's polycystic kidney disease. That's one of the most common genetic ones. And those ones are obviously given down along the family. And then some of them are like sporadic cases of things like nephrotic syndrome. It can also be familial, but it can also just be like a sporadic case.
Yeah. And what would cause that? Would it be a lifestyle? Would it be what kids are drinking, eating, medication? What would it be?
So it's an immunological thing, the genetics, the nephrology, the nephrotic syndrome. It's not really going to be affected by what kids are eating, although some infections can sort of lead to nephrotic syndrome in kids. And some other systemic diseases like lupus can also present with kidney problems.
So, I mean, we hear the word dialysis, and you kind of picture big machines and tubes and all of that. So just explain to us, what exactly is dialysis? What does it entail? And how traumatic is it for a young child to have to go through this? Or is it traumatic at all?
I think all chronic illnesses are quite traumatic, especially for young children to have to deal with. But to put it simply, dialysis is really just a way of us trying to be a kidney, trying to help the kidney that is not able to work. So the kidney obviously does waste products and water. That's what comes out in the urine. So we'll be trying to make urine. And there are two basic ways of doing it. The one is the hemodialysis, where we hook you up to a machine and the blood is cleaned through the machine. The other one is a peritoneal dialysis, where we put the fluid in your abdomen and we use a lining called the peritoneal membrane. That's what we use with the fluid. So you install fluid in, clean sterile fluid, and then you leave it in there for a little while and then you take it out. And that is sort of our way of creating waste and water.
Oh, that all sounds quite traumatic and painful.
Well, the actual doing of the dialysis during the dialysis session is not painful. We insert catheters in that stay in there. So whether it's a permanent catheter that we put into the blood, or we put in a catheter into the abdomen. So the actual doing of the dialysis is not painful at the time that you're doing the dialysis.
So how would someone know, and let's make it quite general. I mean, I know we're talking about kids, but I'm sure the same would apply to adults as well. How would you know that you're having an issue with kidneys? What are the symptoms that something might not be well there?
So the symptoms of kidney disease are vague, and it's actually one of the more silent diseases, and as a result it gets picked up quite late, although we'd like to be able to pick it up earlier. So if you're able to screen things like in adults, especially diabetes and hypertension, those are big causes that for kidney failure in adults. So those are diseases that we need to be screening for and treating appropriately to prevent the complication. Other things, it's more difficult in kids to really pick it up. Things like the swelling of the legs, headaches maybe from hypertension, being very tired all the time. But as you can hear, all of these could be many other diseases. Shortness of breath could be any really symptoms, so any system. So it's quite important for anybody with like a family history of renal disease to inform their healthcare provider so that we know and we can keep it in the back of our heads. And also when kids do go to clinics, I think the other thing that we can do is like blood pressure tests and checking of urine. Those ones might help us to be able to
Would
pick it
regular
up.
UTIs or bladder infections be a sign of a kidney problem?
So yes, definitely they are. Those ones usually indicate, especially in children with UTIs, usually indicate that there's a problem along the system of the urinary system, whether it's in the kidney, in the ureters, or in the bladder. So that's why if a child has a UTI, we usually then investigate and do at least an abdominal sonar to try and make sure that there's no other complications. And we watch children who have recurrent UTIs, because if you're having recurrent urinary tract infections, the assumption is that you could be damaging the kidney a little bit, and you could eventually then run into problems with your function.
Okay, so take care of your kidneys, I suppose, is the message today.
So that is the message, and that's what World Kidney Day is really about.
All right, thanks very much. And that's the Nelson Mandela Children's Hospital's nephrologist, Dr. Tholang Khumalo.